Go Red for Women is so important because when we hear that 80% of heart disease is preventable, that means a lot of the problem is awareness and education. Heart disease in women is not what people expect.
And young women especially.
When my daughter was born in 1989, I had a subarachnoid hemorrhage, which is a form of stroke. A neurologist decided that I was having a panic attack and I just needed to take some pain medication and I should go home and call him on Monday. I went back to the doctor after he sent me home and I said, no, something's really wrong. You really have to do something. And I think had it not been for that, the results might have been a lot different. It's extremely important for women and especially younger women to be an advocate for themselves.
My favorite line that I always tell myself, and I tell other people, nobody knows your body better than you. I was 5 months pregnant with my first pregnancy. I started having chest pain and heartburn, and just walking the length of a hallway, I would have to sit down and catch my breath. So they checked my labs, we did an EKG, and everything was normal. But I went home and I'm like, something's not right. So I decided to go back to the ER again. The second time, the EKG showed that I had a heart attack. Nothing like a second, third, fourth, or fifth opinion.
I think a lot of people look at us and our situations and they think, oh, but you look great. This happens if you're fit, if you're young, it does not matter. 2 years ago, I woke up complaining of arm pain to my husband. I kept saying that I felt like I had a weight on my chest. He kept wanting to call 911, but I was adamant on getting my 3 kids to school. I walked onto the ambulance. I refused to get on a stretcher. We were en route to the hospital and I went into cardiac arrest. It took them 45 minutes to bring me back to life. And multiple AED shocks, 10 plots, I have burn marks, and I stayed in a coma for 9 days. You don't want to ever think about your mortality, but when you're faced in situations like us, your mortality doesn't just knock on the door. It came in, made itself comfortable, and then we kicked it out.
My family didn't have a history of heart disease at all. It wasn't until me and my 2 sisters that it did. My story actually starts before me. I had an older sister who passed away from congenital heart disease, and it was really devastating for my parents. So when they were pregnant with me, they were really proactive. Like, to me today, it doesn't feel like anything's wrong because I don't remember the surgery at all. But to my parents, it was obviously a big deal. Since this is something that happened to me as an infant, I want to make sure that I have a long life here, and the choices that I make every day are what's going to sustain me long term.
Exactly. Know your numbers, know your heart history, know your family history, know your body. And trust it, because when you're talking about heart disease, it does affect anyone. Our hearts beat, anywhere between 50 and 80 times a minute. With every beat, there is a reminder of what we have experienced. We now know better, and anyone who listens to any of our stories can do better.